Okay, hi, I'm Dr. Ian from Click Clinic in Malaysia. It's my first time at DASO 2023, so thank you VIOL for having me here today as well. I'll be speaking on how Sylfirm X plays a role in the treatment of melasma, and I'll also be talking about some other injectable products tomorrow. But today, I think our focus will be on Sylfirm X. Yeah. Okay, I started using Sylfirm in 2019. That was the first generation device, continuous wave pulse. For Sylfirm X, we've been using it for about 2 years now, and our patients have been very happy so far. Well, it is the world's first dual wave radiofrequency microneedling device. You have both pulse wave and continuous wave. So Sylfirm X, its advantage is the pulse wave technology. We use it for a lot of our patients with hyperpigmentary issues like melasma. At the same time, we find that it works really well when you use pulse wave for patients with acne as well. So for me, I have some very young patients. They are the ones who come in with the acne lesions. And when you go to the older age group, you know, your 40s, your 50s, your 60s, you have a lot of patients with pigmentary disorders, and that's where the pulse wave also comes in very handy. So yeah, it works well for a lot of our patients. So it comes with both continuous wave and pulse wave. I use continuous wave a lot because of the skin tightening effects, but pulse wave again because of the acne and how it works really well for melasma. So if you were there for my presentation for melasma, you will understand why we like Sylfirm for the treatment of melasma, how it actually helps to reduce the causes of melasma. The other thing I like about the device is it's very pretty. You know, it's a nice color. Blue is my favorite color. At the same time, it's very easy to use. The handpiece is just like a giant pen, and so it's very easy to maneuver around the face as well. And the third thing I like about Sylfirm is it has very, very little downtime. So patients like that, they can come for the treatment and still go for an event that night. They don't have to worry about having swelling or too much inflammation on the face. It's all very controlled. I have one patient who responded really, really well. So she's someone in her mid-20s. She's a student studying in Australia, and her skin has always been very angry looking. Her skin texture was a bit bumpy, a lot of congestion. She's tried a lot of things. She's tried peels, she's tried lasers, but it just never really worked. So one day, she read about Sylfirm, and she came to our clinic to give it a try. She was only in Malaysia for like 3.5 weeks. So we told her, the most you can do is only 2 sessions, and we'll see how that goes. And so we did it for her, 1 session, and the second session of Sylfirm 3 weeks apart. And her skin it improved so much. She was really red and blotchy, and 3.5 weeks later, she was glowing. She was literally glowing. No injectables were done. And she was just sending me like text messages like, oh my god, my skin is glowing now, it's so amazing. And in fact, because she had such good response to the treatment, I still use her pictures in my before and after today. You know, she's one of the patients who responded really well. You do have patients who, when they come to the clinic, we tell them 5 to 6 sessions, you'll see quite nice results. Even 1 session, you start seeing some, but usually when you do 5 to 6, you see great results. For her, 2 sessions, amazing. And because of that, she's recommended her sisters, her friends to me. So very thankful for that. But we have to say thankful for Sylfirm, right? It's a great device, it's worked well, and it helps our patients be happy as well. Yeah, so really, really like the device.